Now let's just quickly study about leptospirosis and what type of questions can come on this topic. So leptospirosis is caused by spirochete Leptospira interrogans, serogroup Leptospira icterohemorrhagiae, classically being spread by contact with infected rat urine. Alright, and leptospirosis is commonly seen in questions referring to sewage workers. Remember, spirosis, spirochete, alright, and sewage workers. So on sewage worker, most of the time question comes like this. Farmers, vets are people who work in abattoir. However, on an international level, leptospirosis is more common in tropics, so should be considered in the returning traveler. Okay, Weil's disease. Weil's disease should always be considered in high risk patients with hepatorenal failure. So Weil's disease can happen in those patients who are already at high risk with hepatorenal failure. Now, what will be the features? The early phase is due to the bacteremia and lasts around a week. Okay, so it is a week around. So it may be mild, fever, flu-like illness. All of them will not help us find out what might be the cause of the what's the cause behind. But the subconjunctival suffusion like redness and hemorrhage may be the cause. Second immune phase may lead to more severe disease, which is known as Weil's disease. How we will remember this? Acute kidney injury, jaundice, hepatomegaly, aseptic meningitis. I will also show you a mnemonic picture to memorize the Weil's disease. What will be the investigation? Serology. Antibodies to Leptospira develop after about 7 days. Okay, so after 7 days, antibodies will develop, and this also comes as an MCQ, that what is the most best investigation for the leptospirosis. So it is serology. Other one is the subconjunctival suffusion. This also comes as an MCQ, and the most rare disease is known as Weil's disease. Okay. Second is PCR, third is culture. Growth may take several weeks, so limits usefulness in diagnosis. All right. Blood and CSF samples are positive in the first 10 days. All right. So the first most important investigation will be serology, because it is after the antibodies develop after 7 days, and culture for blood and CSF samples are for the first 7 days and for the first 10 days, and the urine cultures become positive during the second week of illness. Okay, this is quite after a long time, and the management is high dose benzyl penicillin and doxycycline. Let me show you the mnemonic for it. Okay, so if you see that how we are going to remember this, that this is caused by leptospirosis, R rat urine, R contaminated rainy water, R rice field or sewage worker, R ring or EMJ's media. Okay, Dinger's ring or EMJH media. Zoonotic disease, and Leptospira is spirochete endoflagella positive in periplasmic space. Okay, so here is another mnemonic for the Weil's disease, VWEIL. Worsening jaundice, elevated creatinine, internal bleeding, and liver dysfunction. Okay, so again, say it behind me, say it after me. W for worsening jaundice, E for elevated creatinine, I for internal bleeding and hemorrhage, and this is the classic triad. Okay, I for internal bleeding means hemorrhage is there. Worsening jaundice is there. If there is elevated creatinine and renal failure, then there will be of course acute kidney damage or acute kidney injury, and last but not the least is liver dysfunction plus lung involvement. So number 1 is W. For W it is worsening jaundice, E for elevated creatinine, I for internal bleeding or hemorrhage, and L for liver dysfunction. Okay, rats love water. So rat urine exposure. Love water means sewage, floods, farming, contaminated water. Common in sewage workers, farmers, flood victims, water sports. Alright. Next is organ involvement mnemonic. Lepto attacks the JKL organs. JKL, jaundice. Okay, worsening jaundice. K, kidney. AKI, and the lungs. I guess this is the good one of the best mnemonics I've ever read regarding the leptospirosis. Jaundice, kidneys and lungs, hemoptysis and pulmonary hemorrhage. Okay, so let us see the features quickly. Organism will be the Leptospira interrogans, shape spirochete, transmission by animal urine to contaminated water, conjunctival suffusion very characteristic, electrolytes are hypokalemia, severe disease Weil's disease, JKL, diagnosis by PCR, and serology is the main. Okay, serology is the main because antibodies shown in the first 7 days or 1 week, MAT and IgM, and treatment is penicillin, doxycycline, and ceftriaxone. One liner, I love one liners. a flood exposed patient with fever, conjunctival suffusion, AKI, and jaundice, think Weil's disease.